Hi, I'm Connor Long, and today I'll be sharing highlights from our recent publication on concussion recovery in team versus individual sport athletes. This was research conducted by the Vanderbilt Sports Concussion Center under the direction of Dr. Douglas Terry and Dr. Scott Zuckerman. To begin, recovery after sport-related concussion is variable, and the potential differences between team versus individual sport athletes are not fully understood. However, given the documented psychosocial benefits of team sport participation, we hypothesize that team sport athletes may exhibit lower emotional symptom scores. Our objective was to compare overall symptom severity scores, symptom cluster scores, and recovery metrics between these two groups. This was a retrospective cohort study. All the athletes were aged between 13 and 23 years old, and they were all seen at a single regional sport concussion center. They were categorized into either team or individual sport athletes. Team sports include things like baseball and football, whereas individual sports include things like swimming or golf. The primary outcomes were the overall symptom severity, the cluster scores across four domains, including physical, cognitive, emotional, and sleep symptoms, and the recovery metrics such as time to return to learn, symptom resolution, and return to play. We had just over 1,000 athletes, 954 who played team sports, and 97 who played individual sports. Here's a box plot comparing the emotional symptom cluster scores between team versus individual sport athletes. And you can see that individual sport athletes had a higher median cluster score. As a note, emotional symptoms include irritability, sadness, nervousness, and feeling more emotional. When we look at the results from our multivariable linear regression, looking specifically at the emotional symptom clusters, we see that there is a significant difference between team versus individual sport athletes, with individual sport athletes associating with a higher emotional symptom cluster score. You can also see the relevant covariates that we adjusted for in the model. As for the other metrics, there were no significant differences observed in the overall symptom severity scores, the other three symptom scores, or the recovery metrics mentioned before. So in conclusion, despite having similar overall symptom severity scores, emotional symptom cluster scores were higher in individual sport athletes. This gives us preliminary data that individual sport athletes may be at a higher risk for emotional symptoms after a concussion. Now, do note that this is a pilot study and follow-up studies are necessary. Thank you.